Substance abuse is a very serious issue, but when we're talking about pregnant women who have this issue, how does that affect and impact the newborn? That's where we're going to be focusing our attention right now. We welcome to the program Dr. Karen D'Appolito, who is the director of neonatal nurses practitioner program over at Vanderbilt, also a volunteer over at March of Dimes. Thank you so much for being with us.
Thank you for having me.
We really appreciate it. I just want to first point out that there was a tenfold increase in babies born with neonatal abstinence syndrome, and that came in Tennessee from the years 2000 to 2010. If you can tell viewers what neonatal abstinence syndrome is.
Surely, I'd be happy to. Neonatal abstinence syndrome, or NAS as we call it, it's really a condition in which infants exhibit clinical signs of withdrawal to drugs that they were exposed to in utero. And as a result of this, many of them require treatment and prolonged hospital stays.
Yeah, and obviously it can be serious depending on what drug was used and for how long.
Absolutely.
Correct.
Absolutely.
All right. What are some of the symptoms, I suppose, a baby would have as soon as they're born? What can you tell us as far as NAS is concerned?
Babies can have physiologic as well as neurobehavioral signs of withdrawal. Some of the physical signs include things like sweating, nasal stuffiness, sneezing, poor feeding, increased respiratory rate, loose stools. So those are some of the physical signs, modeling as well, that you might see in a baby with NAS. Some of the neurobehavioral signs include tremors, irritability, crying, increased muscle tone, problems with sleep.
All right, and these are symptoms that you will notice right away?
If you're knowledgeable about the syndrome and you know what to look for, you can pretty much identify babies that possibly have been exposed to drugs in utero.
How long will a baby have these symptoms before they're starting to get on track for good health?
Surely. I think a lot of it depends on the drug that the baby was exposed to. It also depends on when the mother took that drug prior to delivery. It also depends on how much of that drug has been transferred from the mother to the baby, and also how well the baby has metabolized the drug themselves. So all those factors will play a part in terms of the severity of signs of withdrawal that you may see. Typically a baby may be in the hospital anywhere from 2 weeks to a month or a little more, depending again on the severity of the withdrawal and whether or not we can adequately capture them with our management.
Are there common drugs that are used that are linked to NAS?
Yes, a lot of the narcotics, a lot of the opioids, whether they be prescription opioids or opioids that individuals can purchase on the street, such as heroin. Another one is methadone. And we have seen an increase in the number of pain clinics within our state. And it could very well be that because of more women being prescribed pain medication for chronic pain, that has contributed to the increase in NAS that we've seen.
And what's the treatments for these babies as soon as they're born? What happens?
Well, we do two things. One is we control their environment. We like to provide a quiet environment, a very dim environment for them. We encourage the mothers to participate in the baby's care and to hold the babies as much as possible. We swaddle the babies. We allow them to suck on a pacifier. We provide boundaries if need be so that the babies feel secure. So those are some of the environmental things that we do. But pharmacologically, we can always manage them as well with opioids such as oral morphine or methadone. If we get to a point where we can't control signs of withdrawal with those opioids, then we would add additional drugs to that.
There are so many terrific hospitals, obviously in the state of Tennessee, but are they equipped to be able to handle a baby who's born with NAS?
Well, probably the hospitals that just have a regular newborn nursery may have some difficulty because they may not have the monitoring equipment that might be necessary. Well, that is necessary because if we're treating babies with an opioid, they do need to be monitored, cardiopulmonary monitoring. They may not have the staffing for it. They may not have individual rooms that would facilitate the management and the environmental control of these babies. So I would encourage institutions that have a baby who requires NAS care to transfer them to an institution where they can get the care that they need.
And this is different, obviously, with every newborn, and again, the type of drug and how long it was used for by the mother. But these babies can have a good outcome. They can live a good, healthy life.
Absolutely. Absolutely. Usually once they get through the period of withdrawal, especially from opioids, they don't have any additional problems. Many times you'll hear that possibly babies may have some subacute symptoms a little bit later, several months down the road. If that does happen, it's usually mild and usually self-limiting.
The state of Tennessee has seen an increase in NAS. I imagine that the State Department of Health, as well as the March of Dimes, are doing plenty of things to address it. But if you can kind of enlighten us all and let us know exactly what they are doing.
Okay. Yes, the health department here in Tennessee has been very active and very interested and very forthcoming with looking at this problem and trying to identify why indeed we are having such an increase in babies with NAS. Now it is a reportable condition for the state, so that many of the hospitals are now reporting infants that have a diagnosis of NAS, so we can have a better idea of the magnitude of the problem here in our state. The health department also has developed several grants that have been available to healthcare providers to look at this problem and try to come up with some solutions to the problems. And the March of Dimes has also always been very forthcoming with educational activities for the consumer as well as for healthcare professionals related to substance use during pregnancy and the care of the neonate.
For folks watching today, can you share with them any information or tips that would prevent NAS?
Well, certainly the most important thing is to abstain from using drugs, alcohol, even cigarettes, tobacco use during pregnancy. I think the one thing that's very important to mention is that if a woman is in a situation where she has an addiction or she has a substance dependence while she's pregnant, to get into a treatment program, because the outcomes are very good for women who are in treatment, not only for the mother but for the babies. And understand that neonatal abstinence syndrome is a syndrome that we can treat and that the babies usually do very well. So those are probably some of the main things that I think are important.
All right, the outcome can be good.
Yes.
Is there anything else you would like to highlight regarding NAS that we haven't touched on that you feel is important for viewers
Well,
to
you know, the only thing that I would like to mention is many times you hear people talk about addicted babies. Okay, these babies are really not addicted. They're really exposed. They're substance exposed. So I think we need to get away from saying drug-addicted baby. It has a very negative connotation to it.
Absolutely.
And I think if you look at the definition of addiction, these babies definitely are not addicted to drugs.
So important to point out. Dr. Karen Dappolito, thank you so much for your time today.
Thank you so much.
We appreciate it.
Thank you.